I really have to figure out this recording software. Here's my attempt number 2 at recording chapter 16. So we talked about moms in chapter 15. Now we're looking at babies in chapter 16. So these are our newborn or perinatal guidelines, P00 to P96. So we still have our same basic definition of newborn. We have 0 to 28 days. Perinatal is just kind of a synonymous term for that. So a lot of these codes are specific to that newborn period. There are some that can be used throughout the life of the patient if the condition is still present and there isn't anything coded out of the congenital anomalies chapter. Just like with mom's chart, where the O codes are only used on mom's record, these set P codes are only used on baby's record, so not used on the maternal record. And we still have our same principal diagnosis for newborns. Now we have Z37, so liveborns according to place of birth and type of delivery. These are only assigned once, so on that stay when the baby is born, that newborn gets a Z38 as their principal diagnosis, and then they're not going to ever get a Z38 again after that. Once in a lifetime used on the baby's record. After that, they can have some additional codes from this chapter if there are some problems occurring with the baby. And we can take a quick look at those. Sorry here. We'll take a quick look at the Z38 codes. So liveborn infants according to place of birth and type of delivery, as I said, for the baby's chart. So you can see it indicates that it was single liveborn or twin liveborn, and then if they were born in hospital, delivered vaginally or cesarean, born outside hospital, etc. And those can be found in your alphabetic index under the main term newborn. And then you can look for the subterms like born in hospital or born outside hospital or something like that. There is a guideline concerning any condition of a newborn that could be due to either the birth process or it could be community acquired. If the document doesn't say, if the documentation doesn't say, or even if the physician's unsure, kind of the default here, we don't really have an unspecified, so the default is that it's due to the birth process. Again, if they're in kind of that newborn age, that 0 to 28 days. Few more guidelines. We still have the section for observation and evaluation of newborns for suspected conditions. So newborn could be brought in because there's something suspected but they don't actually find anything. Can use these P00 to P04. The prematurity and fetal growth retardation, we have P05 and P07. Just a quick note. If the record documents both the birth weight and the gestational age, then you actually get 2 codes here. You get one for low birth weight and then you get one for immature gestational age. And you'll see one of these on your coding practice online for this chapter. We still have the Z91.7 low birth weight and immaturity status. So this is for those patients that were low birth weight at delivery and are coming back, and they might still be having problems from that. So think of this almost like a history. It's kind of a status post code. And then the P95 for a stillbirth is only used for those facilities that maintain a separate record for stillbirths. Otherwise, that's usually just captured on mom's chart. So here's our practice, kernicterus of newborn due to isoimmunization. And this is one that doesn't come up too frequently, so you can see I typed in kernicterus here, 3 of 3 findings. So the first finding, I'll just go back there really quickly, came up under isoimmunization, newborn with kernicterus. We get the P57.0. The third one is that kernicterus as a main term of newborn, and then we have due to isoimmunization. We get the P57.0. And we can take a quick look at that in our tabular. Make sure we're in the right spot. Again, kernicterus due to isoimmunization. So we're good there. Get P57.0.